We always talk about the power of prayer, but sometimes we have to actually pray in order to have it work. So we're offering a little prayer this week for moisture. I know we have some in the forecast. The experts say that we're in for an extended drought. And we think there's a higher power at work here. So we're going to say, Heavenly Father, if you find it in your heart to help us out, please bring us some substantial rain. Make it steady. Make it a warm, soaking rain that will heal our forests and heal all the vegetation in our area and help prevent the fire danger from growing. We pray this in Jesus' name. Amen.
Welcome to the Forum, your way to keep up with state and community leaders, experts, and local business leaders. This is your chance to hear from and talk to people that affect your life right here in Rim Country. You can express your opinions by calling 474-2427. And remember, the comments and opinions of guests and callers are not necessarily the opinions of KMOG. Welcome to Rim Country Forum.
Good morning, Charlie Seraphin on the Forum, along with Dr. Ali this morning. And before we get going, we always like to thank our sponsors, Holiday Cruises and Tours, the Dana Law Group, Furry Friends, Hospitality Wireless, Pinnacle Propane, Realty Executives Arizona Territory, the Owens Law Firm, and Sunshine Cleaning and Restoration. Well, good morning, Dr. Ali. How are you?
Good morning to you. Happy to be here.
I'm going to talk about you before you get to talk about what we're going to talk about. Dr. Ali, if you don't know, is a board-certified cardiologist and a board-certified phlebologist. That's a vein specialist. He has over 20 years of experience in cardiovascular diseases. He practiced in Los Angeles before expanding his services to Gila County, and that's an interesting story that we heard last time, why he's here in Gila County. He started several cath labs, including one at the Cobra Hospital in Globe. He has been involved in the innovation and the use of several new treatment instruments and modalities for cardiovascular care. He provides vein consultation and other vein centers in Arizona and California and holds faculty positions at the University of Southern California as well as the University of Arizona. He's a very bright man. And we're going to talk about veins this morning. Dr. Ali's cardiovascular and vein practice, Heart, Artery, and Vein Institute, located at 127 East Main here in Payson. It's open 5 days a week, 9 to 5, staffed by courteous and skilled staff. And if you have cardiac or vascular needs, that's the place to go. They practice accepts Medicare, Tri-West for veterans and all major insurances. And if you'd like an appointment, the number is 928-238-1388. That's 238-1388. And it's always a pleasure to introduce you, Dr. Ali.
Thank you. Thank you for the kind introduction. Happy to be here.
Yeah, thanks for being here. Today, I was thinking about our topic for this morning, and I teased it yesterday and said we're going to talk about legs. When we think about a house, we think about the foundation goes in first, and the foundation is there. But after that, we don't think about it a whole lot. We think about the decorations, the doors, and the windows, and the roof, and the siding, and all that. And I think with the human body, it's kind of the same thing. Our feet and our legs are the foundation, but we don't spend a lot of time paying attention to them. We pay more attention to other parts of the body.
I think it's a great analogy, just like how we take the foundation of a house for granted. We have learned over the years, generation after generation, to take our legs for granted. For the benefit of people, for my own understanding, I have a new motto.
Okay.
May I?
Yes.
So that is, keep your legs strong so nothing with your heart goes wrong. And I'll explain it.
Okay. Keep your legs strong so nothing with your heart goes wrong.
Yes.
That's kind of poetic, too. I'm just saying.
Well,
it's alliterative. I guess that's what they call it.
Yeah. So one of the most common advice you get from a heart doctor or from anybody who's trying to help you with your heart is stay active. The two advices. One is eat healthy. The other one is stay active. Of course, you got to make your appointments with your doctors, take your medication, etc., and those are accessorial. But as a person, you can do those things. You can do those two things, eating healthy and staying active. Let me paint a scenario. You want to stay active. You get out of bed, and your legs are kind of achy. Your legs are not quite strong. Your legs are not saying, well, let's go run. So how are you going to stay active? So weak legs achy legs, legs that are on your mind, legs that have cramps, legs that are swollen, legs that have skin discoloration. These are legs that are weaker, that are not quite able to do the job, so you cannot be active. And if you're not active, then your heart is not going to be strong. So that's the explanation.
Yeah. And so I guess the approach would be, if your legs are, my legs are a little tired today, that's still a sign you need to use those legs. You need to walk and you need to move as much as you can.
You do.
Yes.
You do. And if despite that you're not getting the result out of the legs, and we're going to talk about this a little bit more as we go along, then you need to figure out why is it that your legs are not the strongest part of your body. And there are reasons for it. And there are reasons that, humanity, people, and the medical field have been neglecting for a long, long time. And I'll explain why. And I'll also explain why we're interested in the legs now, and we were not that interested in the past.
Well, someone listening right now is sitting in a chair and listening to the radio and going, I know exactly what you're talking about. What do we call that? What do we call the fatigue in the legs or the tiredness of there? Is there a medical description for it?
Well, you can call it any which way you want, but the most common reason why your legs are not as strong and potent and they're not serving you is because of a disease, actually, that's called chronic venous insufficiency. It's an extremely common disorder. It's more common than all the heart disease and all the arterial disease in the body put together. It is 6 times more common than diabetes mellitus. So, I'm going to have some astounding statistics, and there's a reason why we're going to be talking about this topic. So,
okay, we have let's go to the phones. We have a question this morning. Good morning. Welcome to the forum. Who's on the line?
Good morning. This is Joe.
Hi, Joe.
Hey, I just want to say hi to my favorite Dr. Ali there.
Hi, Joe.
And you too, Charlie. I'm taking COQ10, and I'm not taking it because I'm on cholesterol, because medication like statins, because a doctor had told a friend of mine that's on it that he was having pains, and it was due to the statins pulling certain things out of his system and causing him to have pains. Now, I take this COQ10 because it was advertised to be good for your heart and everything else. So I'm wondering, am I taking this for nothing, or is this a good product for me?
All right. Thank you for your call.
Yeah.
What do you think, Doctor?
Well, the COQ10 on these herbs, and they've been studied. The results on those are, less than stellar. Some people might benefit from it. Now, who benefits from it and who doesn't, obviously, they have to go through a cardiac eval and all that. My own personal stand has been to not encourage too many people to be on that, because it somewhat reverses the effects of statin. That's the most common reason why people take statins. To answer that question as intelligently as I can, I guess you try it and see
how you feel.
How you feel.
Can it hurt you? Can it?
No, there's
not really.
Most herbs are kind of they're
but it just
common,
washes through your system.
They wash through your system. Yeah. So that's the most intelligent answer I can come up with. You can try if you feel compelled and see how you feel. Is there a difference? And then you decide: do you want to spend the money and be on it, or do you want to give yourself a trial of no medication and see how you feel? You kind of serve as your own guinea pig.
So you said that the chronic venous insufficiency, this leg disease, is more prevalent than diabetes.
6 times more common than diabetes, and that may be an underestimate.
Wow. Well, then does everybody who have sore legs, if your legs are sore, is it chronic venous insufficiency?
They need to be evaluated. They could, we'll talk about all the different reasons, why people can have sore legs. But here are rough statistics. At about age 50, men, women, there's a 40 to 50% chance you may be suffering from chronic venous insufficiency in the legs. And all people are not going to be very symptomatic, and so that's where the problem is. The reason it's an underattended condition is because it's not flagrantly symptomatic. And symptoms are very insidious. They develop very, very slowly. And because people are, synchronously aging, they seem to attribute it to the aging process. Well, of course, we're all going to age. But imagine, why do you not feel achy in your arms, but you feel achy in your legs? I mean, most people complain of some ache in the legs. So by age 50, your chance of having CVI, chronic venous insufficiency, is at the 40 to 50% range. With every decade, at age 60, it's 60%, age 70, 70%, age 80, 80%. If you're 100, you got it. So simple way to understand how common it is.
So, can you give us a layman's explanation of what it is?
What exactly?
We got
yes.
the name. We got a name, and it's a chronic venous, and
yes.
it's not spelled different than the planet, but it's chronic venous insufficiency.
Yes.
But in layman's terms, what's happening in the body to create that situation?
Well, this thing called gravity, I think, has existed before human beings were made. And I'm not here to point any flaws in how the human, body was made or anything. That's not up to me. But we were destined to be on our 2 feet only, as opposed to some mammals and other animals. They're on their fours. We're never on our fours. We're on our 2 legs. So all day, whether you're sitting or standing, gravity is acting against you. And that puts pressure on the veins. See, the function of the veins, these are blood pipes in the legs, is to pump blood back to the heart. Arteries will pump blood away from the heart. They bring it to your feet and your toes, and then, there's distribution of blood to the tissues, and veins pick up that blood, and every single blood cell that has been released from the heart must go back. There are no holes, so there are no,
Well, we hope not.
Hope not, yes.
Yeah.
So as the veins are trying to push the blood back up, they're constantly fighting gravity. Nature provided valves within the lumen of the veins to prevent the falling of the blood downward, toward our feet. But with age, lack of exercise, obesity, etc., and there are some risk factors, those valves become somewhat incompetent, and then blood starts to flow in the opposite direction. Instead of going all the way toward the heart, it starts to flow toward the feet. And then you start to see swelling of the feet and all the other, characteristics that go along with that. So that is basically what chronic venous insufficiency is. There is no infection, there is no inflammation, or there's nothing, but it's a physical phenomenon. And it's almost impossible to escape with age because of gravity.
And gravity is constant, but the valves over time lose the strength or the ability to be able to hold the blood from that.
Yes.
There you go. Well, we're going to talk about the chronic venous insufficiency in terms of treatment and diagnosis when we return. You're listening to the Rim Country Forum. Our guest is Dr. Mir Ali, and we'll have more after this. Welcome back to the Rim Country Forum. Charlie Seraphin with you, along with Dr. Mir Ali. And today we're talking about legs, and specifically we're talking about leg swelling and chronic venous disease, which is chronic venous insufficiency, is another way of saying it, right? 2 names, same thing.
Yeah.
And so someone is listening right now, and they're going, okay, I've noticed I've got some, either some swelling or some pain in my legs. Now what? What do I do?
Well, the best thing to do is to get evaluated. Determine, there's several different causes of swelling. Every swelling is not connected to chronic venous insufficiency. One of the causes that needs to be ruled out right at the outset is congestive heart failure. When the right side of the heart is not functioning vigorously, it causes the same thing. The blood starts to pool in your legs and ankles, and there is swelling of the legs. So that needs to be ruled out. And you can't do some calculations at home and say, well, according to this, I don't have congestive heart failure. Dr. Google is not that good yet.
Yeah, we'll get by Dr. Google and go and see a real doctor.
So there are other causes for swelling, like inflammation in the tissues, especially joints. For example, ankle joint can be inflamed and have swelling. There are injuries that people can sustain, even though they may not remember, like sprain and fractures maybe that were not detected on X-ray, etc. Obesity can present with leg swelling.
How does that work? If obesity causes the leg swelling, what's physically happening? You have a lot of fat cells in your body, but what causes you to kind of swell up like that?
Obesity basically slows the metabolism and speed of every physical function of the body. So it also makes venous flow sluggish. It causes valves to be sluggish. Obesity makes a person, pretty much from hair to toenails sluggish. So that probably would be my best explanation as to why.
Yeah, and gravity, because you have more mass, so the gravity has more that's going to be pulling downward.
Yeah.
Okay.
Leg injury, and like I said, there's a condition called inflammation around the veins. It's called phlebitis. Some people may have heard it. It is not the same as a deep vein clot, which is a different condition altogether, and that can cause swelling and what have you. And people who smoke cigarettes are also subject to more chronic venous insufficiency. Another one that you cannot change is genetics. If one parent had chronic venous insufficiency, there's a much higher likelihood of a person developing the same disease. If two parents had it, it's more or less a done deal. You have it. So you said if you have chronic venous insufficiency, what do? The acronym for that is RACE, R-A-C-E. R stands for resting intermittently. A stands for activity intermittently. C for compression socks or compression stockings. And E for elevation of legs. When you sit down, you keep your legs elevated, like have a chair in front of you or an ottoman or something. Basically, you're kind of negating the effects of gravity. So that's a temporary measure. Eventually, obviously, depending on how serious the condition is, you may need to consult a physician and have the physician guide you in treating your condition.
What are some of the treatments that and we're not trying to treat somebody over the radio, so they say, oh, yeah, I can just do that. But the race thing is easy to remember, that we can do that.
Yeah.
But if someone comes to see you, are there chemical treatments? Are there drugs that you would take that would help ease the condition a bit? You're not going to cure it, right? Completely?
There's better cure for it than for diabetes. There's better cure for it than for blood pressure. There's better cure for it than heart disease.
Okay.
Yeah. So obviously when you go visit with a doctor, they'll completely do a thorough evaluation, a physical, going to your medical details and all that. And then they have to make a diagnosis. The way to make a diagnosis and either rule it in or rule it out is through ultrasound. It's a very innocuous procedure done at the office. And the ultrasound will not only say, is there chronic venous disease, it'll actually measure the amount of reflux. When the blood is flowing in the reverse direction, ultrasound will tell you, is it flowing for half a second only? Is it flowing for a whole second? I mean, anything above half a second is abnormal. And if you have symptoms because of that, then you need something done. Intervention is necessary, and the intervention depends on the seriousness of the disease. Once a diagnosis is made, I most often ask people for a 3-month period of conservative treatment where they're not getting anything done by me, but they're following the principles of RACE. They're staying active, they're taking intermittent rest, and the deal. Now, if that didn't help, then we go into correcting of that incompetent vein. And there's many ways to do it. The older method is via thermal energy, like radio frequency or laser, and a lot of people still do that. My preference over the last 4 or 5 years has been a modality that's much less painful, much less hurtful, much lower complications, and a great extra patient satisfaction. I use what we call physical or mechanical rotation device, along with the injection of a tiny little chemical called polydocanol. The procedure is much shorter than a thermal procedure. It takes about maybe 10 minutes, to correct a vein. And people jump out of the bed and they're ready to go about doing their business. So there's no rest period or no recovery period. It's a very simple treatment.
Is it the mechanical device? Is it is it a structured massage kind of thing on the leg in a certain direction? Or?
Good question. It actually enters the lumen of the vein. So you go inside of the abnormal vein. You go inside of the target vein. You identify where the reflux is. To kind of go over the procedure. The patient is laying in a bed. They get they don't get sedation because there's no need for it, but they get some local anesthetic with lidocaine. The rest of the procedure after that, people have no feeling because we have already covered them with lidocaine. You enter the vein with a needle, and you use that passage hole to introduce a large catheter that goes all the way up, depending on where your disease is, where the reflux is. And there is an outside trigger that either I'm holding or my assistant is holding. When you activate the trigger, it rotates inside the vein, so it's a mechanical rotational device. That rotation creates a situation of suction, and it brings the walls of the vein together, so it shrinks the vein. And as you inject this little chemical alongside, that chemical acts like a glue and shuts off the bad vein. I immediately get asked, "Doctor, I only have so many veins and you're shutting my vein off, so what the heck's going on?" Well, the answer is nature has provided with a plethora of veins around the bad vein that are functioning quite adequately. So they've been actually already working extra hard. This one gives them a chance to work less but more efficiently. Blood is, returned to the heart without losing a heartbeat. And your circulation improves, and over time, the swelling goes away, the aching goes away, and I've had people come back to my office who are now able to walk without holding a cane or a walker. They're able to hike and stuff like that. So it's a nuisance disease with easier to treat options. I can't say that for high blood pressure or diabetes or heart disease. And here's the beauty of it. Once the vein is fixed, there's a 90 to 95% chance over the next 5 years, maybe even 10 years, that it is still going to remain fixed. All the chronic changes that people may be suffering, redness of the skin, thickness of the skin, itching, aching, cramps, inability to move around, they all subside.
It's just amazing to me that if it's 6 times more common than diabetes, but we're listening to the forum today, and I'm going to guess that the vast majority of our listeners, me included,
they have
never heard of it. We don't know anything about it.
I'll tell you.
But we have, but leg swelling or leg pain or the effects of gravity. I mean, we can all relate to that. I mean, there's at some point or other, we either know someone or have it ourselves. But it goes undiagnosed.
I'll tell you why it has gone undiagnosed and why there is a resurgence of us, focusing on this one. Prior to 2009, we did not have satisfactory treatment modalities for this condition. The options that were available were where your person had to be hospitalized. They had to go through surgery, pretty invasive surgery, and the surgeon would go in and strip the entire vein out of the body. Pretty extensive butchery. And then we found out the procedure did not work all the time. A lot of the procedures that I do now are failures because of that procedure. Nothing wrong with the surgeon. The surgeons didn't do anything. It was just not the correct way to treat this condition. Body has a memory. If you remove something that the body think it belongs there, body tends to reproduce it, recreate it, and put it back. And that's what happens. Body just produce another vein and put the vein right there. But if you shrink the vein, which we learned, the smart thing to do, left the vein there, body never thought the vein is missing, so it does not try to produce another vein, by the side of the vein that is treated. So that started to happen is about 2009. See, in medicine, we kind of don't talk about stuff we cannot do. Simple. But if we are able to do something, then we start talking about that. So starting 2009, this became a topic of conversation, and people start to get the therapy done. As of 2014, I believe that was the year, this newest modality came to town, which did not use any thermal energy like radio frequency or laser. And I think we were one of the first ones in the state of Arizona after FDA approval to use it on our patients. I didn't make them guinea pigs or anything. I was fairly comfortable with the procedure. As a matter of fact, if I'm going to have that procedure done today, that would be the one. It's called mechanical rotational correction of veins, mechanical chemical modality. So now that we know what to do, I feel eager to talk about it. But if you had brought me on the show before 2009 and said, "Doctor, can we talk about chronic venous insufficiency?" I'd step out and go get some coffee.
Yeah.
Yeah.
And we'd miss you while you were gone. 27 minutes before 10 o'clock on the Rim Country Forum. Thanks for joining us this morning. I'm learning. I hope you're learning too. There's a lot there, and I'm hoping that there's someone listening that says, "You mean I can actually cure this situation? I've had the swelling in my legs and my pain, and I'm becoming less and less active because it's really it's a task. It's a chore to just even walk to the bathroom or walk to the kitchen because of the swelling in my legs."
I don't think people should even think about waiting until such time that they're having difficulty walking to the bathroom. If you're unable to jog, if you're unable to exercise, if you're unable to have fun on a weekend and stuff like that, because your legs are keeping you from doing that, you have a situation that's easily correctable. And it'll contribute extraordinarily to your health, because if you have strong legs, they translate into strong entire cardiovascular systems, including the heart. That's why I told you at the beginning of the show, let's keep our legs strong so we... Whatever I said,
Yeah, let's go back and remember that. Yeah.
Let's keep your legs strong so nothing with your heart will go wrong.
Yeah, keep your legs strong so nothing with your heart will go wrong.
Yes.
And we're gonna be counting on you to come up with the brain transplant. That's the next big breakthrough that we're looking for.
It'll take some
medicine.
time, yeah.
Okay, we're going to take a break on the Rim Country Forum. If you have a question or a comment, 474-2427 is our number. We'll have more with Dr. Ali right after this. You're listening to the Rim Country Forum here on KMOG with Dr. Ali. I hate to even ask this question, but what are the consequences if someone doesn't seek treatment for swelling of the legs and leg pain and itching and cramps and that sort of thing?
So the consequences, they're easy to answer. Obviously, you keep suffering from all those things you just mentioned. Your legs are continuing to get weaker and weaker. They're not going to support you. Your walking abilities, getting sacrificed on a daily basis. And sometimes people have nightly cramps and what have you. So not getting it corrected indirectly, like we said, is also contributing to your cardiovascular, status. The weaker the legs, the weaker the heart. Because if your legs are not moving, the circulation is not moving, the heart's not pumping, and your heart muscle is getting kind of lazy. Maybe you have a normally functioning heart, but you're just not, putting it to exercise because you're not walking. Walking, moving your legs. See, when the doctor says, well, I want you to be on the treadmill, every morning for about 15, 20 minutes. Well, what do you need to do that? You need strong legs. And if you don't have strong legs, you're not going to do that activity, and then you're going to compromise your heart situation. So that's why I'm kind of like promoting this theme to get a strong heart. You got to have strong legs. I'm completely, thoroughly convinced of that because I'm making this observation in my office day after day after day. People who walk in robustly into my office, I listen to their heart's beating robustly. People who walk in kind of slumped, you can tell their legs maybe are swollen or weak and not supporting their body. You listen to your heart; it's not as robust. You measure their ejection fraction on the echo. Their output, cardiac output, is not that great. There's such a direct relationship. I know the books have not talked about this yet, but I'm sure the next time the books are written, I think this relationship is going to be established and explained to the communities.
Strong legs, strong heart. Let's go back to the phone. Say good morning. Welcome to the forum. Who's on the line?
Hi, this is Helen.
Hi, Helen.
I just want to testify. For years, I've gone to doctors, and they keep saying, "Why is your leg so red? Why are they so swollen?" Well, you're the doctor, but they never did anything. I went to Dr. Ali for something completely different, and he said that. He goes, "Well, I can do that," and he's fixing it. He's wonderful. That's all.
Awesome. Thank you, Ellen. Appreciate your call. So there's a testimonial.
Yeah.
It does work. It can change. And, you think about it, if you wait until you're in your 90s, it's a much more complicated situation, and the effects are not going to be as dramatic or as beneficial. But if you're in your 30s or 40s, if you're otherwise a young, healthy person, and that's the question, how early can this disease set in? How young can a person be and have the chronic venous insufficiency?
Do you want to see who the call? Okay. Yeah. So the answer to that is simple. There is no real lower age. You can have this in your 20s if you were inheriting it from both your parents. You shouldn't. A lot of women who have this disease start observing this when they are pregnant, so around times of pregnancy. Now, here's where I tell people. Once you're Medicare age, for example, that's a good time, regardless of whether you are heavily symptomatic or not, to pay attention to your legs, because by age 65, imagine there is a 65 to 75% chance you may have leg venous insufficiency, you just have not noticed it. So it's an easy situation to diagnose. It's easy situation to fix. It's not like blood pressure. Oh my God, now I got blood pressure diagnosed. I got to take these medications for the rest of my life. It's not like diabetes. Oh my God, now I got diabetes. I got to worry about so many different things, and I got to take this. No, it's a physical disorder. It's kind of not even a disease. It's a physical disorder related to gravity, and it's correctable.
A vein shrinker. That's what you need. Let's go back to the phones and say good morning. Welcome to the forum. Who's on the line?
Hi, good morning. I would like to ask the doctor something. My mother had severe varicose veins when she was, as I was growing up, and I remember her suffering with them. When I was 24, after my second pregnancy, my veins started to pop out, and I'd gone to the doctor, and at that time, like the doctor had mentioned earlier, they stripped both the major and minor veins in the legs. I really haven't had too much problem. Now that I'm in my 80s, my legs, it's for the past, 6 to 8 months, maybe the last year, my legs have started to swell. And I was just wondering, since I've already had that other procedure, you said it doesn't work as well. because of the memory that the body has.
Yeah.
What are the odds of your treatment or whatever working for someone who has had that?
Yeah, so not having actually evaluated you and done an ultrasound, it's risky for me to state the odds. But I think the odds are enough that you need to be evaluated. Do the race, principle that we talked about, stay active, take intermittent rest, and wear compression stockings.
Yeah.
And keep your legs elevated. If you so choose, call our office. Come say hello to my absolutely wonderful staff. I do that every single day. And if there is something that we can bring to the table, we'll be delighted to. If there is something that we think, we won't be able to help or we can't intervene, we'll be happy to say that too. So.
Well, until I talked to you this morning, I kind of had been attributing it to the fact, because I'm usually very, very active. But since this COVID thing, I'm staying home. I do sit with my feet elevated, but I'm sitting so much more than I ever did in my entire life. And I just was kind of in my mind's eye, I thought, well, maybe it was because of that. But could that be any kind of a contributing factor to?
Possibly.
Yeah.
Yes.
Okay, well, thank you very much, Doctor.
You bet.
I will call and make the appointment.
Yeah.
Appreciate your call this morning. That's great.
I wanted to educate the audience on one simple thing. This is kind of it could get a complicated subject. So if you are, sitting in your living room or wherever and listening to the show, hopefully you're not driving, lift your pants up if your pants are covering your ankle, and look at the inner side of your ankle just above the heel where that big bump is. The big bump is called the medial malleolus. So the area between that medial malleolus and the border of the heel, in that area, if you see a lot of network of veins, like a little map of Google that doesn't really lead you any place, that is medically called corona phlebitis. Corona means crown, phlebitis means bad veins. So that's the crown of bad veins. It's a wrong crown to be wearing in your ankle. If you have that is almost like a 90 to 95% chance that you have venous insufficiency or chronic venous disease. I'm teaching the audience over the radio a clinical sign
how to diagnose your...
for self-diagnosis.
There you go.
That'll be a new one.
Yeah. So when you look at that and you see the veins between your ankle bump there, the inside of your ankle bump and your heel, if you see them, you always have veins there, yes, that you're going to be able to see?
No, you should not.
You should only see skin.
We think they're normal because we have... After age 30, 40, 50, we have gotten used to noticing that and thinking they're normal. If you have that, it hasn't killed you or anything, but that is telling you that the venous return, blood going back to the heart, is not happening vigorously, and that is the reason, because the blood is backing up, it's nurturing those abnormal veins. Corona phlebitis, just listening to the word, phlebitis means bad veins or pathologic veins. So you cannot have pathologic veins and think to yourself, just because I've had it for 10 years and it hasn't killed me, well, it should be normal. No, it's not normal. It's abnormal.
I'm going back to the brain transplant now because I remember putting my socks on this morning, and I remember I look at my feet while I'm putting my socks on.
Yes.
So I must have seen it, but I don't remember whether or not I'm seeing veins or just skin.
The next time, pay attention.
Yeah,
yes.
I'll be taking my shoes off here in
a
a couple
lot
of
of
minutes.
people pay no attention to the legs. A lot of people pay no attention to the legs. They pay a great deal more attention to their shoes, but they don't know what kind of feet have gotten into those shoes. I ask people, I enter a patient exam room for whatever reason. I know without looking at their ankles, their pants are covering the entire leg. I know they got a huge amount of swelling sitting inside of those pants. So my question is, do you have any swelling in your legs? The immediate answer is no. I carry out the conversation. I don't want to, prove anybody wrong instantly. Then I say, may I take a look at your legs? And they're like, well, I came here for my heart. I mean, what's in I said, well, you have swelling, and they still don't see the swelling. Then I have to poke a hole in their edema, because it's called pitting edema, and then I show them a hole. They say, oh my God, I never saw that. Well, obviously you didn't, because you're not your own doctor, and you have gotten used to not looking at your feet. You stand in front of a mirror. How many times people have looked at their feet in front of a mirror? How about zero? And most mirrors don't go wall to wall, so there's no opportunity. Everybody is so focused on their face and their brows and their eyes. I mean, they should be. But legs are the ones that carry the entire body, including your eyes, your nose, your face, your whatever. As humanity, I think we just neglect our legs.
Yeah. I thought of something earlier. This is really kind of out there, but I like to always ask my out there questions. You were talking about, as our species evolved,
yes,
we went from all fours to upright.
Well, not everybody believes that, so be careful.
Okay, well, some people believe that, and some people are still walking around on all fours. I'm just saying, you don't see them often, but once in a while. Yeah. But so, are animals exempt from this condition because
Charlie, you are a bright host. You are a very bright host. Extraordinary question. I have the answer for that one.
Okay, good.
I have the answer for that one. Animals don't have varicose veins or chronic venous insufficiency. They don't. None. There's one instance where varicosities were found in a cow's udder. And you know when that is? When the cow is breastfeeding. So that is a normal engorgement of veins that nature has provided, so there'll be more milk produced for the calves. But that is not the same as chronic venous insufficiency. But you can see the udder, and you can see all these varicosities. They kind of look not good.
Yeah, but they can't walk on their udder anyway. They don't use that for walking. Yeah. But it doesn't happen in their legs because of the design of the body.
That's the design of the body. I told you at the outset, I hate to be the pointer of flaws.
Yeah, folks. I'm just saying, if you're at home in a comfortable position right now, you need to take your shoes and socks off, and you need to look at the inside of between your ankle bone and your heel, and look and see if you can see veins. And if you see veins, then you've got an issue, and you probably need to go see Dr. Ali. We've got a call here. Let's go to the phone.
Sure.
And oops, I got to go to that one and say good morning. Welcome to the forum. Thanks for calling. Who's on the line?
Sam, and thank you for taking my call. I turned 50 a couple years ago, and I noticed at night I get cramps on my legs, sometimes on my feet. Can you answer how can I control that, or is there a medical I can get to prevent cramps at night? Sometimes at day, but mostly at night.
Yeah. So nightly cramps are a common condition, and there's many different reasons. So because there are different reasons, I can't just suggest one method or one medication, for all, because that's not how it works. You can have cramps because, you may be suffering with electrolyte imbalance. For example, if your blood does not have enough potassium or enough magnesium, you can get cramps. You can get cramps in the legs, you can get cramps in your belly, etc. You have chronic venous insufficiency. We've been talking about that all hour. Then you can have cramps. And there's a host of other different conditions. The best thing to do is to knock the door of your primary care doctor and say, hey, doc, I'm a young guy, otherwise healthy. I'm assuming this is how the gentleman is, but I'm suffering from these nightly cramps. Can you give me some guidance? I couldn't tell over the phone, just listening to someone who has got cramps, give them, a treatment prescription. I couldn't do that.
Yeah, Sam, are you in a position where you can take your shoes and socks off and take a look at the inside of your ankle, the area between your ankle bone and your heel?
Yes, I already did, and my left ankle seems to have more veins than the right one.
I hate to be the bearer of bad news.
Yeah. Well, it's a good thing.
Yeah.
Because based on what you've said, it's a high likelihood that he is a candidate for this surgery.
Yeah, but
it's not a surgery; it's a procedure.
Yeah, it's a procedure. Yeah. But everybody who has the corona phlebitis doesn't necessarily need the procedure. I'm saying it's a sign that indicates you have it. Now, it also doesn't necessarily mean the cramps are coming just because of that. I mean, yes, it's there. It's one of the things to keep in your head, but cramps have other reasons to be there too. Yeah.
Okay.
Yeah. Okay.
All right. Thank you very much.
Okay. Thank you very much. Yep. And if you want to get it checked out, see your primary care physician. And if you don't have a primary care physician, or you're not satisfied with what you've heard in the past, you can go see Dr. Ali, and it won't take a long time to do the diagnosis, yeah?
Well, it'll be an office visit, and eventually at some point you need to do an ultrasound to determine is there chronic venous disease and is there significant or pathologic reflux. So I don't want to totally simplify it. It's a simple thing, but we got to follow protocols,
Yeah, a lot better than stripping veins out of your
definitely.
legs. Oh, my gosh.
Definitely.
That's kind of barbaric if you think about it, right?
I won't be on the radio show talking about it. Yeah.
Okay, well, we'll have more. Everybody's taking their shoes off now, taking a look at their feet and their ankles. That's a good thing.
Yeah.
And we'll have more with Dr. Ali right after this. It's a Wednesday Rim Country Forum with Charlie Seraphin and Dr. Mir Ali. And today we are talking about chronic venous insufficiency, and which I never heard of before, quite honestly.
You can just say leg swelling.
Well, leg swelling, but I'd like the name. Chronic venous insufficiency it's a good name. It's a technical medical term, and we should all know that, especially those of us that are long in the tooth. If you're over 50, 60, 65 years old, as you said, when you're Medicare eligible, it's likely that this is going to happen, and by the time you're 100, it's guaranteed.
It's guaranteed. When you become Medicare eligible, then it's a great time to get this checked. Mm-hmm. It's the most simple thing to diagnose. Does not cost a huge amount of dollars. Simple to correct.
There was a period of, I'm trying to remember if it was the 60s or the 70s, but there was a big fad in this country, and a lot of people did it, where they had those tip you upside down machines where you guys strap in and you go upside down. And I don't know what the theory was, but there was some health theory connected with it, and I'm thinking about gravity, so it was a zero gravity device of some sort. Does anything like that help with a physical condition or your heart?
I'd like to say it might, but I don't think there's a randomized study that's been done to say for sure it does. But if you think about it, obviously you're not upside down all day. You're upside down maybe for so many minutes, maybe no more than 15 to 30 minutes. Mm-hmm. So people thought it helped them with circulation more to the brain. That's what I recall.
Well, the blood does run to your head because gravity works when you're upside down.
Yeah. So,
if you can stand on your head, you're in really good shape.
Absolutely.
I think if you can do that, put your feet up against the wall, stand on your head, knock yourself out. Right?
Yeah, I mean, from an intellect perspective, I think there are some benefits to it. But have they been documented medically, and are there any guidelines issued? The answer is no. But if someone wants to try it, I have no objection to that.
Okay. Yeah. So we found one really good diagnostic tool that you can do yourself by looking at that area. Are there others? Are there other things?
Swelling.
Okay.
Number one, actually, one of the most common reason for leg swelling. Now, the problem with swelling is 8 out of 10 people do not know they have swelling. So I'll maybe give the audience a couple hints. If you look at your legs and they're looking okay to you, that may be because they're actually okay, or that may be because they have not changed from the last day or week or month or year, and you think they're your normal legs. So okay doesn't cut it. So here's what you do. You stretch your index finger and you go to the inner side on the shin, in the side of the leg, and you poke it steadily and keep poking, just say for 15 seconds or 20 seconds, and then you lift it up. If you see there is a little dent or there's a little hole, you have swelling. That's how you define leg swelling. If you just look at it and you say, oh, I look all right, you are the worst judge of your health condition.
Bad legs, yeah.
Yeah.
So you're talking about where your calf muscle is on the other side of your shin?
The shin is on the inner side of the leg. So, the leg, imagine you're standing and say if I'm facing this wall, the audience is not looking at the wall. There's the outer side of the leg, there's the inner side of the leg. From the inner side of the thighs, go all the way down. So we talked about the medial malleolus, the bump on the inner side of your leg. Go, say, about 6 inches above that, on the inner side of the leg.
Okay.
I'm taking you there because you're very close to the bone. And when you poke, you are putting pressure against the bone. So it's easy to diagnose if there's swelling. If you are creating a little crater or a little hole or a little dent, then you have leg swelling. So that's one of the other things. If you look at your legs and their color is significantly different from the color of your thighs. Now sometimes that may be chronic sun exposure, but not all the times. If it's darkened, reddish, or blackened, then there's an issue. If you see any flakes in the lower part of your legs, there's an issue. Any leathery feel to the skin, there's an issue. Now, if you have some kind of a wound or an ulcer and all that, now we are way beyond. So those are, some of the different things. If I examine 100 people, random from patient, they just came, I guarantee you 80 of them will have significant venous insufficiency and not know about it, because it's a very insidious condition. It happens so slowly in your head, you think it's just part of normal life. I'm growing, my hair's gray, my shoulder's aching, my knee has a little condition, and my legs are aching, so it's just nothing, I'm aging. Wrong.
Take care of your legs.
Take care of your body.
Take care of your body and take care of your heart.
Yes.
Thank you, Dr. Ali, for being here. Appreciate our sponsors, too. Holiday Cruises and Tours, Furry Friends, Pinnacle Propane, Realty Executives Arizona Territory, the Owens Law Firm, Sunshine Cleaning and Restoration, the Dana Law Group, Hospitality Wireless, all wonderful companies locally. Please support them. Tell them Charlie sent you. God bless you. Have a beautiful day. We'll see you again tomorrow morning at 9 o'clock here on The Forum. You're listening to KMOG Payson.